Yeah, you're like. Yeah.
Cole was looking. Wait.
Afternoon, in like the span of 15 minutes, Student State University took the programming of WCSB
Yeah.
students.
"9:30 a.m. right now." Director? Yes.
Gadwell,
Here.
Moore,
Here.
Ray, Hirsch,
Here.
Howard Jones, Lyman, Mr. Chairman, you have the floor.
Muchas gracias. I need a pen. Necesito bolígrafo, por favor. Got me. Okay. Ordinance number 1167-2025 by Council Members Conwell and Griffin by departmental request. It's an emergency ordinance authorizing the Director of Public Health to accept a grant from Ohio Environmental Protection Agency for financial assistance for the operation of the Division of Air Quality, authorizing the director to enter into, mic is off. I'm going to do it again. I'll say it over again. Ordinance number 1167, 2025, by Councilmember Conwell and Griffin, by departmental request. It's an emergency ordinance authorizing the Director of Public Health to accept a grant from the Ohio Environmental Protection Agency for financial assistance for the operation of the Division of Air Quality, authorizing the Director to enter into one or more contracts for materials, service, equipment, and supplies, authorizing contracts with various agencies or entities and for professional services, determining the method of constructing, rehabilitating, renovating, replacing, or otherwise improving air monitoring sites and other similar structure on city-owned and city-leased properties, and authorizing the director to enter into one or more contracts for improvements. Ordinance number 1167, 2025 was approved by the Director of Public Health, Finance Director, as well as the Law Director. Health Director, sir.
Thank you to the Chair, to the Council. So this is our routine legislation where the Ohio EPA funds our Division of Air Quality. It funds 3 programs within our Division of Air Quality and about 30 personnel. The programs are our enforcement section for Ohio EPA violations, our engineering section for those permits for the polluters through Ohio EPA, and our air quality monitoring section. With me to my right is Brian Sokolowski, our Chief of Air Quality Monitoring, to answer any questions.
So this grant and the money, when you say a grant, you should put a dollar amount.
Yes. The dollar amount is $2,725,620 per year. And it's a 3-year grant. 2-year, I'm sorry, this is for 2 years.
2 years.
2025, October 1st, 2025 through September 30th, 2027.
Oh, I see it. I see it in the legislation.
And we've had this going back 20-something years. 30,
No, since
40,
since
60,
EPA
70,
came about in the 70s. Since we became a local EPA office.
hundreds of years.
Right. And you, with this equipment and services in here, you air monitor it, and can you explain the process
Of particularly for air monitoring or kind of as a whole?
as a whole?
Yeah, so, the director mentioned we have three sections, and it's very circular on what we do. One section benefits another, and we all use the information to coexist. So the permitting section or engineering section, they write the permits for facilities. So any facility that emits into the ambient atmosphere, from anything from a gas station to the big steel yard to dry cleaning facility, they all require Ohio EPA air permits to operate. So we write those permits. They're issued by Ohio EPA, but we actually have engineering staff that write the permits, and then they get authorized and issued by the director of Ohio EPA. Then we have enforcement, which enforces those permits. So they go out and do inspections. So we have a required number of inspections per our grant. So, we're receiving these dollars. We have to do things. So we have a required number of inspections we have to perform. We do complaint investigations as well, from like open burning to asbestos complaints. If you have an odor or dust in your neighborhood, we investigate those complaints for all of Cuyahoga County. And then if there's violations, then the enforcement section would issue notices of violation to get these companies into compliance or individuals. And then the monitoring section, we monitor the air to see if we are meeting the ambient air quality standards that are set out by US EPA for the criteria pollutants. If we're not, then that tells permitting that they need to make stricter rules for us to come into compliance to meet those standards.
Who is the we that monitor the sites? You have systems in place, and you have so many people to monitor it.
Yeah.
You
So
have the equipment to monitor it.
Yeah, so we have 12 people. I manage 12 people in the monitoring section. We have operators, we have technicians, and we are heavily audited. So we are audited by the state EPA. They have an auditor comes around multiple times a year and make sure our equipment is meeting all the specifications. We have US EPA comes in, does audits through the probe and side-by-side audits. And then every 3 years, US EPA has a special team. They do something called a technical systems audit. This is all out, it's a week long. They bring multiple people in and they go through everything. They go through all your certifications, all your paperwork. In order for us to operate one piece of monitoring equipment, we have to have almost a dozen NIST certified pieces of equipment to calibrate and make sure, and these instruments have to pass rigorous testing every week or every month, depending on what's required by US EPA. So that the data we generate is good, valid data.
And so when you get the data, say for example, in neighborhoods like Huff, Glenville, Fairfax, how is the air quality in those communities? And do you have sensors in those areas to monitor the air quality?
Yeah, so we have a couple different networks going on. We have the Ohio EPA Ambient Air Monitoring Network, which is the stationary sites. A lot of those are around the Industrial Valley, and we have a couple out. We have one in Collinwood area. We have another one in Near Road down in Warrensville. But that's something we saw is we don't have anything because we place these sites, these monitoring sites, where is modeled based on facilities, roadways, a number of industry where we're going to get the highest readings. We don't want to monitor an area where there's no facilities. That's going to give us not good data. It's not going to give us relative data to what's actually out there. So a lot of our monitoring sites are around the Industrial Valley, which we have a lot of our highways and we have a lot of our industry. Now, we had a want from the community to get neighborhood level data. So we actually put out a grant through the IRA, and we were awarded $500,000.
When you say IRA, the acronym?
That's the Inflation Reduction Act. That was the federal Inflation Reduction Act that they put out opportunity for local offices to enhance air monitoring in environmental justice areas. So we went for it and we got it. We were awarded $500,000. So yes, so we have rolled out about 26 of the 30 sensors. You can access these in real time on our dashboard. We've worked with the city and it's on the city's dashboard. I can send out a link, but this is neighborhood level data. This is throughout the city of Cleveland. These sensors are located. We'll have about a total of 30. We're trying to fill in the gaps right now. We have a pretty good spread, but we're looking at the map as a whole and saying, okay, where do we have some missing areas? And we're kind of using those last 4 or 5 sensors strategically to fill those gaps.
Sir?
Add to the chair. In 2 weeks, we'll have our operational oversight meeting, so that map and that data is included in that operational oversight meeting.
And yeah, and this is something we push out to and we have meetings quarterly with the public. We've sent out invites. We go to libraries. We put out our flyers. We want people to go to because it's called Clean and CLE is what we call this program, and we try to push it out that this is a resource that residents have to see hyper-local data for their area. And all these are in the city of Cleveland, all the sensors.
Great. I asked my assistant to reach out to your department. I want you to come. I was talking about the environment at my last community meeting. We don't have a lot of trees in my community, and we need more trees to deal with the air quality that's there. I mean, in meetings, people ask me to get trees cut down. you know, and I know why, because the roots that tear the sewer line up, and you have to spend a lot of money, $1,500 to $2,000, whatever. Councilman, it's that tree that the city put out there. So we want to have that tree cut down, but it's tearing it up. Then I go, but Ms. Jones, I hear you. Here's my issue. We need more trees because of the environment. We need more trees so we can deal with a lot of health issues. You need trees, but we don't have that many trees.
It's really about finding the right type of tree. And, you know,
Okay,
it's-
see, we don't know that.
You know, it's, I know sustainability has a tree expert, I think.
Yeah.
No.
Well, urban forestry.
Urban forestry,
Division, yeah.
you know, so it's, you know, don't put the massive oak on a small plot right next to sewer line. It's, you know, it's about planting the right size, type of tree, size tree, right, you know, it's got proper growth and that fits our natural area, so,
Yeah, tear the sidewalks up.
yeah.
You know what, let me ask you this question, you know, I like to walk, well, you know, we walked for a long time in my neighborhood, and we got to figure out a way to have vegetation, trees, and vegetation in the urban areas more, in these side lots, open space lots, that we have marigolds, and you know what I'm saying, snapdragons, and that you have urban farms more, that way air quality is better.
Yes. Yeah, our, you know, this funding specifically doesn't, you know, allow us to do that, but I agree, yeah, absolutely. It's very important.
Yeah, I look at those things and like, man, we need that stuff. That's very, very important. And I was telling my residents, you know, when I talk with them about the environment, they mainly talk about, when I call you about, groundhogs and raccoons and skunks and those things. But I told them as a council member, I need to be talking about the environment as well and tell you guys about other things that you're not thinking about that we need to work on also, like the environment. The environment means a whole lot to my community, the city, the state, the country, as well as the planet.
Yeah, and you mentioned, you know, I know our outreach section will be happy to come out to one of your meetings to speak. They do it frequently, at public safety meetings, at other, you know, different, wherever they're asked.
Yeah.
So, just let us know.
Probably director visit some of the schools also, the elementary school children.
Yep.
We probably could cultivate them about the environment when they grow older. It's part of their DNA. You know, if we had that in the school system, and they could learn maybe coloring bugs or whatever the case may be, to talk about the environment as well.
Absolutely.
Any questions on ordinance number 1167, 2025?
I have a very vague general question. It's got nothing to do with the ordinance though, so through the chair.
Well, let me,
As an expert on air quality, monitoring air, is it the case that in Cleveland, the winds mostly travel from west to east?
Yes.
That's all, thank you, Chair. I just wanted verification, I've been saying this.
you have put it on record. So with that,
So in the summer, we
Clarification.
receive more southwest. And then in the winter, more out of the northwest. Yes. So that's, you know, we get that lake effect snow as it comes from the northwest, the summer southwest winds. And that's, those southwest winds is actually how we get those
that's very good.
high ozone days. Because the lake has an opposing force and it builds, ozone builds up along the lake.
Okay.
where your training come from? Where your training come from? You studied where?
So I studied at Cleveland State. I got a bachelor's degree in biology. I focused on environmental and then started off entry-level position in enforcement section. And I spent 10 years there before I migrated over to the monitoring section and the chief position came available. So,
That's good.
Groom within.
yes,
Yeah, you cultivated him.
a lot of training.
I was going to ask you about that. So you guys constantly train?
Oh, yeah.
Training is ongoing?
Yeah, we have a state required training programs. You know, the city has their own trainings, but Ohio EPA, in order for us to keep our contract with the well-trained individuals. So it's not, about when we have people come on board, they have certain trainings they have to perform, and then there's a kind of a progression. They get more difficult trainings as they go through their life as a air quality person.
I know you had to get training, and it was ongoing, and so that's good. That's very, very
And
good.
a lot of the trainings are offered from the US EPA. The US EPA will develop the trainings, and they have a whole portal that we can access, and it tracks all their training. It's very-
You guys go to training sessions, or do they come here, or what we do?
Both,
Virtual?
All of
the
it.
above.
Yep.
There's virtual, in-person, we'll do a combo hybrid ones. People will come to us because we work with specific vendors for our equipment, so they'll come and talk to us about the equipment and how some of the idiosyncrasies of how to operate it.
So, Director, all this idling out here with vehicles, a lot of the city vehicles, they idle. They get out when they're in their vehicles, and I see them, and it's their behavior
Yep.
to do that, because we've been doing it for so many years. You get out, you leave your vehicle idling, and then all the, you know what I'm saying?
Yeah, no, we're with you. So we put in a budget request for this year to give us some funds for those signs that you've legislated, and we're putting together a strategic plan to address that.
That'll work. That
Yep.
definitely, because you know what, we have to lead the way first.
That's right.
We talk about businesses and companies, but what are we doing to lead the way? We have to show the way, that we deal with idling, with police cars, with, because we own so many vehicles that we have to show the way we're not idling.
Right.
And then we can try to change people's behavior, because they'll point straight to us.
Right.
Okay,
I have one statement.
yes, Council Lady.
I just want to say, could I have your card? I was
Yes.
with a young man yesterday out of the neighborhood, and he has interest in air quality, climate change, and he asked those specific questions. What is the city doing regarding that? And he just turned 18, and he has an interest in following that path in his career. And by this coming up, I told him I will see where, who's in that position so he can have some direct answers to his questions per se.
Absolutely.
Because he wanted to know what the city was providing or what type of programs they have. So I'd like to have your card after the meeting. Okay, thank you. All right, Chair.
Yes, yep, absolutely.
Come on up, Catrice.
What threats or risk do you see dealing with air quality in the city of Cleveland, the state of Ohio? What do you think is headed in our direction that we could try to do prevention?
There's, outside of the overall, the budget, the looming budget, reductions and stuff. Outside of that, we've, US EPA, based on scientific studies, they looked at the 2.5 standard. That's the fine particulate standard, and they determined that the standard was it wasn't strict enough. It wasn't low enough. So they reduced the standard from 12 micrograms down to 9 micrograms. As a result, and then there's a many-year phase-in of how this works. They just don't say it's starting now. There's a long phase-in of this, but we're going to more than likely be in non-attainment for that standard. Currently, we're in attainment for that fine particulate standard, and then we'll have to find some interesting ways to get into compliance with that. So these are all things that we need to work with the state, work with the feds to come up with plans on how we're going to achieve attainments.
How do you think you can have the citizens step in to help?
So it's, I'm sure we'll have some activities. Open burning is a big source of fine particulate, so reducing that. but the main reason why we're not attainment is not because people are open burning. It's a lot of, people don't think of it, but it's a lot of the farming that happens when they turn over the soil in Indiana, Illinois is in that, and even Ohio, that fine particulate can travel for thousands of miles. Just this year, we had Saharan desert sand being picked up on our monitors. From Africa. That's how far it travels. It's that fine. It's 2.5 microns or smaller, and so the width of a human hair is 70 microns. So that's how fine we're talking of particulates. So it gets up in the upper atmosphere, and it can travel very, very long distances. So, and it can get deep into your lungs and into your bloodstream, and there's a lot of adverse health effects. So.
Sahara Desert is part of ensemble.
Yes.
Wow. So I'm there with that, and we'll discuss it when we come back for the operations. We're going to do an operations. That, Vice Chair, and we'll meet with them.
2 weeks.
Yeah, we'll meet with you guys this week. I have to huddle with the Vice Chair and meet with you beforehand.
Cool.
Or maybe even after this, if we can huddle for 15, 20 minutes, and then we'll move forward. All right, thank you.
You guys. Yeah. All right.
All right, thank you, young lady. Introduce. young sir. My mind is still messed up. I'm trying to act like I'm not messed up, man, but I'm trying to, Yeah.
So with me to my left is Patrice Miner, who is the Director of Community Health Initiatives at the Cleveland Department of Public Health, and she has been leading our strategy implementation for tobacco retail licenses, which you all know, thanks to legislation that you passed in April, will go live at the end of this month, 6 months after the legislation was passed. And so we are very excited to present what we've been up to and pass it over to Catrice.
Thank you, Director. Thank you, Chair. Thank you, Committee, for having me here this morning. Director of Community Health Initiatives. Yeah. So I did prepare a few slides. I'm not going to spend a lot of time on the first few slides because this is just rehashing things that we've already done. In particular, the legislation that was passed, the comprehensive tobacco legislation. There were 4 pieces. The piece that I'm going to talk about today is the 4th piece, which is the tobacco retail licensing program. That was passed along with the others in April, and there was a 6-month time period in which the implementation was to take place. So that legislation goes into effect October 13, 2025, so a week from today. Okay. I also won't delve too far into why we passed this legislation, but I will say that this provides us an enforcement tool on the local level to go into retailers and make sure they're compliant with the licensing requirements. And it also helps protect youth, because part of what we'll do during these inspections is have underage decoy buys that will see if retailers are complying with Tobacco 21. And part of the reason why we want to do this, and this was part of the legislation in the whereas, is that most people who begin smoking start before the age of 21. So, the who. There is not a comprehensive list of all of the retailers in the city of Cleveland, but we've done a lot of work combining and cleaning different lists that list different retailers. So our estimate is that there are about 800 retailers in the city of Cleveland. And a tobacco retailer, by definition, basically is anyone that sells tobacco products within the city of around 800.
We were at 500.
Well, we didn't have a count, we were guessing. And so as people have been coming in, applying for their certificates of occupancy, and I mean, you've seen them in our neighborhood, so that's what, anywhere from 500 to 800, and they fluctuate. They're opening, they're closing, but as soon as the new ones open up, we've been able to stop them because they don't have an occupancy permit.
Oh, okay.
So
Remember that.
we're getting the word out.
53 per ward.
53 per ward.
It's awful, yeah.
Oh, man, that's terrible. That's
Yes.
horrible.
Yeah, and the state, the state's gonna crack down. Any retailer, yeah.
Right, so that's grocery stores, that's gas stations, that's pharmacies. There's a number of individual bars, lounges,
That's right.
and we're talking all tobacco products, cigarettes, cigars, vaping. Okay, so this is a great opportunity to educate retailers and the public as well. So again, thank you for having me here. But I do want to go over some of the other activities we've been up to try to get phase one done, which is educating the public and retailers. So the first thing that we did, which we actually started in June of this year, is I created this palm card, and I created a website, a registry for retailers to pre-register for the tobacco license so that we can start getting an idea of who is a tobacco retailer. So this palm card, we worked with Case. They had some summer interns. They were doing store audits, and they would go into the retailers and do this direct contact with retailers, telling them about the tobacco retail license, and then also giving them an opportunity to scan the QR code to register and become a part of our registry. So I brought a couple, or more than a couple, copies. Yep. On the back of,
Some of the council members,
Sure.
yes.
Thank you.
On the back of these cards, there's also, you can have all of these, and we can get more printed. And I have more in the office. On the back of the card, there are frequently asked questions. So what we found to be asked by most retailers is, how is this different than the cigarette license that they have that's from ODH? And that was the learning curve that we had to get around for a lot of individuals. They think they already have a license, and we needed to explain to them that this is a new license and it's different than what they've had previously, and in addition to what they have. So that was part of the direct contact that we've had with retailers, and then the registry is ongoing. So these palm cards that you have here will also go out with some of our staff. A lot of the retailers that sell tobacco are not new to us. They are either licensed food vendors, or we're in contact with them for some other reason. So we're going to continue to try to get retailers on the registry so that we have a better idea of who to contact once the application opens. Yep. The other direct contact that we're going to have with retailers is what I call give and gab. We did this previously when the state did new signs for no smoking. They changed them to no smoking, no vaping, so people were clear that that included vaping. We would go to retailers, we would give them copies of the new signs and talk about vaping and smoking and how they can be compliant. So what we'll do in the next coming weeks is have the sign that they have to have when we do inspections, which is saying that tobacco is not, you cannot sell tobacco to anyone under the age of 21. We'll give them copies of that sign and talk about the legislation too and the requirements. So we've also done some billboards. To the left is the first run of billboards that we did, also on the bottom right. Those are two examples of billboards. We have them throughout the city. We're trying to reach every corner of Cleveland to make sure that everyone is aware of the requirements. This is the first run of billboards. We have another run that will go out the end of October once the application is open, that will help direct people to it. And then we also are going to do some radio ads. We have done some social media spots. We have our website where we have information about the tobacco retail license. And we've also been in contact with some industry and some chain retailers, like your Marks or your Family Dollars, those retailers. They account for about 10% of the tobacco retailers in the city, according to the list that we've pulled together so far. It's yard sign season. You see a lot of yard signs. We put yard signs out for folks It's very similar to these palm cards where they can scan and register. Yep. And we'll put more out for folks to see and scan. On the registry too, what I think is helpful is that if anyone has a question, they can put the question there, and then I respond to those questions directly. Once the application opens, we'll have videos with how-tos to show them how to complete the application. We'll do some webinars, workshops, and I'll even do office hours for retailers if they have questions and need assistance. We'll do a webinar somewhere in November or so once the application opens, a virtual webinar. But I'm also going out to community meetings, talking to individuals, because what we would also ask is the public to help. They can call 311 if they have a tobacco retailer that they frequent, if they notice after December 31st when they have to have their license that they don't have one, they can let us know so that we can send our team out there to make sure that they know that they need to be compliant with the TRL. And that's the end of the presentation,
So, you know, we could, as you walk my neighborhood with me, Director, we could go out and talk to residents in the Glenville community, talk with some of the key stakeholders, you know, Martin E. Poor Center, J. Glenn Health Center, Glen Village over there. We'll put together a plan by me being the chair, and we'll show the way the first of the year, you know, and it doesn't, that way we could see, and we're able to look at lessons learned. I'll invite you to some, now you know what would be really cool? I'm thinking right now, I'm just thinking about it. When we do Coffee with the Cop or Jazz and Coffee with the Cop, we bring in a lot of people for that. They come in. And we could put something on the side and discuss cigarettes. We could do that. We could hit the recreation centers, Glenville Recreation Center, you know, the guys are there. Because you have the audience there. The barbershops, beauty shops, there's there. You have a captive audience there at those places, and talk with people. You have the Department of Aging with Mary McInerney. She's always putting on programs like Walking Sensations, which is healthy, and then we could throw those in to discuss that with our residents. Even Senior Day have something there, a booth. So I don't mind sitting down and talking with you about, you know, we could write up some things, because it's gathering places in a lot of different centers, you know. And then they have also a collaborative, different CDCs and not-for-profits. They have collaboratives. You know about that, right? Yeah, and we could talk with them and step right in. Just offering some help when I was listening to you on how how we could benefit with this. So I'm there. I'm wide open to help.
I'll just add too that we have our internal staff that go into different retailers. We are going to work with Building and Housing, who also go into different retailers to get these palm cards in their hands too, to be able to give it to retailers directly.
But you know what? Here's the thing with Building and Housing. When they go into retailers, the retail people are afraid of them. And so they're looking, while you're talking with them, they're watching that inspector. But if you go in with an outreach person, or like Flamencos, they have community outreach people, or you go in with the council member, you're walking in, you know, you see what I'm saying, different, in a different way. That Building and Housing, they're looking at enforcement, and then that might push things away. I mean, that's just where I'm at with that.
No, point taken, because we really want to emphasize prioritize education first before we get into the enforcement piece.
PTAs is nice too. You visit the PTAs in the schools, make them partners, write down all key stakeholders and partners. You can talk with PTAs because they have the children there. And when you have parents, and because you got to push it everywhere, all key stakeholders, and it can tell you where some other things are that I might not even be thinking about. So I'll walk you into the businesses. I'll do that. It's no problem. But I'm kind of pushing back on, not to say they're bad guys building housing. Just you walk in with your council member. I think that would be that's easier with the businesses.
I'm open to going to additional board meetings, community meetings, wherever I'm needed. I'll go and I'll talk to folks.
My colleagues? Council member?
Okay. Thank you, Mr. Chair. I do have a couple of questions, and I think I've got them down to 7. So we'll just. But the.
Number 3 is my
Oh, 3 is your lucky number. So I'll do.
Who's
two
an
groups of
activist?
3. I'll do 2 groups of 3, and we'll have an addendum. Through the chair, the list of applications already on file, is that available online, or can you just send us an Excel sheet that tells us which applications have already been received, so we know which vendors in our wards are already on paper?
the chair soon. So the application is not open yet. It's going to be an online application that will open at the end of the month.
Oh, through the chair, I thought October 13th was when the retail license had to be on file.
The legislation went into effect October 13th, but because the license expires December 31st, they get basically a little grace period for this first initial licensing period. So
So through the chair, what is the deadline for them to be licensed?
December 31st.
December 31st?
Yes.
Oh, so you open on October 13th, and they've got till December 31st?
Yes.
We should have made it December the 11th.
Okay,
Probably.
okay.
Oh, your birthday?
No. 7th. Just laughing.
That was over my head, sorry. So through the chair, so you'll have a growing list of retailers that are applying for their license and then being confirmed for their license, and you'll let us know periodically what that batch looks like so that I can know if the stores in my ward are licensed up.
Through the chair, absolutely. So
Okay.
because we have somewhat of an idea where the retailers are, we should be able to, once the applications come in, figure out where we have low compliance and then be able to be targeted in our outreach to those areas.
Okay. And through the chair, I think this was legislation number 1,167 for 2025, so we do a lot of legislation, pardon me if. Oh, okay, well, it's a high
Good,
number.
you good,
so
though. You still good.
Please forgive my memory. Was there going to be I'm sorry, was there any interaction with the marijuana sales that we're seeing in the neighborhood that are popping up as well? Tobacco doesn't include hemp products, or does it, through the chair, does it include hemp products or any other smokable, I don't know what you call things you smoke, smokable things?
Go ahead.
Well, so the tobacco retailers is encompass of those, so all those places that are selling like those marijuana derivative products are tobacco retailers because they're also selling nicotine products.
Right.
So we'll be in there.
Will they be able to remove nicotine and traditional tobacco and continue to sell the other items, or they still have to register?
I hope not. Through the chair, the state law has passed a bill through their House unanimously, and hopefully will be passed through the Senate shortly that doesn't allow Delta 8 and all those marijuana derivatives. Yeah, exactly.
7% THC in hemp products.
Where all of our state folks are saying we're very, very close on that one. So
Okay.
that will help a lot because that would be pretty tricky.
Yeah, so it gets, the waters get muddied pretty quick, so
Yeah.
through the chair, Madam Chair. The follow-up then to that is, what is the enforcement on this? If a retailer is not licensed up, how do we shut them down? How do we enforce this and actually put an end to that business if they're not going to follow our laws?
So within the legislation, there's first escalating fines. If a retailer is not compliant with any part of the legislation, I believe the first fine is $500, the second fine is $750, up to $1,000, up to the point of revocation of their license. If their license gets revocated, then they go through the court system to have their buildings shut down,
Sealed,
essentially.
right.
So ultimately, the city could board up a business if they're refusing to be compliant and have exhausted all of their opportunities to become compliant.
Through the chair, yes.
A board up, okay. Through the chair, I heard you say that you were gonna have young people going in underage to it. Do you need volunteers for that?
Through the chair, yes.
I have an ambitious 13-year-old who would probably love to enlist. I don't know. She
Well-
doesn't look 13, it's so crazy. Oh, 19.
Sadly, there are retailers who are selling to kids who are much younger, but the legislation requires for 18 to 20-year-olds. So those are the age groups that we have to go in to do the underage buy.
So we recognize adults under the federal laws, but not, that's the, okay.
And, sorry, through the chair, to your point too, just so folks know too, we're hiring a staff person who is going to help manage that process too, because that can be a very, yeah.
Through the chair, I know that the police will send people into to bars to purchase without being ID'd to verify that they're selling, potentially to minors, and like we will need the same type of, but this wouldn't be a police activity, this would be your department, right? Okay, next question, just a silly question that crossed my mind through the chair. Are cigarette machines still a thing? Do they exist in bars? Is this still?
Through the chair, it just so happens I was at a Cleveland facility and I saw a vape vending machine, yes. So not only are there cigarettes in vending machines, but there are also vapes in vending machines. And those establishments too would have to have a tobacco retail license.
And those are very hard to monitor the age of the person using the machine.
Well, part of the legislation requires that if they have those items in their facilities, that it has to be a facility where you have to be 21 and up to enter.
Okay, interesting.
And it also has to be in a conspicuous place where you can see the actual machine. A staff person has to be able to see the machine.
I'm sorry, the machine has to be inaccessible to the public, or I'm sorry, I didn't
No,
understand.
it has to be within view of the retailer or as an employee of the retailer.
It can't be in the back hallway where
Can't be in the
nobody
back
can watch.
hallway, can't, right.
Got it, okay.
Let's move.
My last question, and I appreciate all your time this morning. So you said that I think 10% of expected retailers are chains, the Family Dollars and that Speedways or whatever. Meaning that, 90% are probably smaller, locally owned. And I think that, I'm sorry? Locally owned, yeah, right. And I think that for all of us, corner stores are a blessing and a curse because there's always people in our neighborhoods that need places they can walk to pick up things like milk and bread. But we also know that the corner stores primarily make their profits on alcohol and tobacco. This is probably their largest profit margin, and that's where they're sort of making their money, and the milk and bread might be a side offering that might not even, So I'm wondering, when I walk into a corner store, it is just wall-to-wall advertising for alcohol and tobacco. That's like all you see. Like there's a cookie over here, but there's like 15 ads for vape or whatever. Is it your opinion, as an expert in the subject, that there would be any benefit to reducing the annual licensing fee in exchange for reduction in advertising? Like if you kept your tobacco behind the counter with no advertisements for tobacco, and it was like, it's over there, it's in a brown paper bag, and if you really need it, we've got it, but we don't advertise it in exchange for a lesser licensing fee. Do you think there's any way to like try to use this to reduce the amount of messaging that is put forth in a store? Because I take my kids into a store and I hate to do it, right? Because they see nothing but tobacco and alcohol ads when they walk in that store. And I'm just thinking if there's like a way to leverage.
Through the chair. I think data will help with that. I think after the tobacco retail license is in full swing and we have an idea of how compliant retailers are, I think that gives us an opportunity to be more creative and think of other things that we can do. I know that flavors have been on the table. That's something to consider. Also, there are disposable vapes that we might want to consider regulating just because it makes it a lot easier for youth to engage in tobacco use. And we do have the legislation about signage. The outdoor signage can't be more than 25% of the window covering. So, yeah, so I think, right, so I think once all 4 pieces of legislation are in place, I think after we get some data to see what's happening, I think we can come back to the table and think of what else we can do to help curb teen use or youth use of tobacco products.
Okay, and
That's
Mr.
the
Chair,
point on this right here.
yep,
That was great that
absolutely.
you just mentioned.
One more thing I want to say. It's
To the director.
It's just an observation.
Do you think that the state legislators, because when they did, you think the state legislators would kick in and knock down some of the items even that you just mentioned, instead of us being able to bargain? Sometimes the state, we get blamed for what they do. Isn't that true? Yeah, they go downstate, talk with the state reps or state senators, and they turn around and they tell us we can't do it. And that was a great idea what you said, but the risk, the state reps or state senators stepping in. What you think? What's your assumption?
State reps right now are trying to do something good in outlawing the sale of the marijuana derivatives outside of the the registered cannabis dispensaries. So we're hoping they get that done right when they get back into session. All signs point to hopeful. But they also, yes, 3 years ago, they created a law that would ban local tobacco regulations like ours, but we've won in court twice now. And that's been appealed to the Supreme Court, and we're, hoping for the best.
Lobbyists, we can afford lobbyists.
Yeah. Well, it's Supreme Court through the chair, so it's not, I don't know. Yeah.
All right.
Mr. Chair, I just want to wrap up one more thing, and I'll get off my soapbox. But I asked about the advertising because I know that advertising has powerful impacts on children. And even though we might not know that they're susceptible to it, I remember when I was a kid, I had a poster of Joe Camel in my bedroom, right? This was a cartoon.
You tell me about that.
Drawn, right? And the whole point of this cartoon was that kids like cartoons, and I had a poster of a cigarette ad in my bedroom for years, right? And I remember Congress outlawing that. I think in the 80s, they said, okay, no more advertising to children. But you saw a shift in I think they even took it off TV, right? Tobacco can't be advertised on television. So like reducing advertising and messaging to children has an impact that we feel down the road. And if there's a way for us to get involved in that sphere, advertising is just about the worst thing that was ever created. Public education, wonderful, advertising, bad. But I just wanted to put that out there, and that's all, Mr. Chair. Thank you.
That sounds good. That was great. So we're joined by Councilmember Slife and Councilwoman House Jones. Yes, Council Vice Chair.
I also realize I don't think these microphones are actually working. I think,
I
we're
think it's
gonna
for
pick
us.
Up by these.
Oh, my God.
If you don't mind.
Yeah.
I'm very grateful to see everything moving towards implementation. And the biggest question or misunderstanding that I still have in my office is about the difference between some of the BZA and city planning requirements and then tobacco retail license enforcement. Because we're having some of the previously existing smoke shops, the ones that were there prior to this kind of like uptick in recent years, that then it seems to me like they're being pulled into BZA, and I'm not quite understanding what was grandfathered and what wasn't. Are you touching the city planning work, or could you give us a primer for both the public and the business owners about the city planning aspects versus the tobacco retail license aspects?
That was long.
Through the chair. I'll start, and then I'll have maybe Director jump in to add more. So the conversation that I'm trying to have with the public is trying to separate the two. Yeah. So I need folks to understand that the tobacco retail license is for anyone who sells tobacco products. So that's the big fish for me. And for folks to understand that if that is the case, then you need to make sure that you are getting your license and that you're staying compliant with the law for that. The smaller fish are those retailers that have more than 20% of their inventory or sales dedicated to tobacco products, so the smoke shops. So that is more of planning and building and housing, and tobacco retailers as a whole is more public health. So while we are getting involved on some level during our inspections, checking to see if they have a certificate of occupancy that says they are allowed to operate as a smoke shop, most of that then goes back to building and housing and planning, so that if they're not operating with that proper CO, that they go through the proper appeal process through BZA.
Got it. So I just want to make sure I sort of get the Venn diagram. The tobacco retail license is going to cover everybody who sells tobacco, whether it is a small part of your shop like a gas station or a bar, or whether it's a large part of your shop like a smoke shop. So everyone's got to do tobacco retail license. But for those that are more than 20% tobacco, that we might consider those smoke shops, we're also having the problems of like the illegal marijuana sales or hemp Delta 8 products. There's going to be additional requirements around the occupancy permits for those smoke shops. Is that correct, through the chair?
Director?
Yeah, through the chair, so every business in Cleveland needs an occupancy permit. We found out for the smoke shops, well, you passed a law for the smoke shops specifically that they can't be within 2 miles of each other and X amount of feet from schools. And so it turned out after we passed that law that a number of smoke shops did not have any occupancy permit. And so then they applied for an occupancy permit. They got denied because there's no space left in the city for another smoke shop. And then that's where it's going to BZA. But there are also smoke shops that have an occupancy permit that just says general retail because they got the occupancy permit before the smoke shop category specifically existed on the form. And then those ones are also going to BZNA and probably have a better chance of winning their appeal because they've existed illegally at the time. But the one that got rejected a few weeks ago that Mr. Castell covered didn't have any occupancy permit. And so that's why, they weren't following the law.
Got it. I wonder if for, especially with the operational reviews coming up, we might not have time, but I think it'd be good to have city planning and building and housing come in as well to do their version of this, just so that the public can understand. Because, and even like business owners, I'm getting a lot of requests and a lot of BZA applicants about it. So just understanding the landscape separate from the tobacco retail license is what's happening with city planning and the occupancy permits.
Yeah, you know what, that could work, because you're going to discuss the, well, you have this young lady to discuss the process. So city planning is in it, as well as building and housing.
Yeah.
Yeah, so we could bring someone from there and they could narrate it better. Great idea. Okay, any other questions on the tobacco? Oh, I forgot. Council lady, I'm sorry.
Thank you, Chair.
You know what, it's better with that microphone.
All right.
It picks you up fine.
Yes.
You don't need to speak into that one the way you do this one.
Okay,
That one will pick you up. You're good.
Yeah, okay. Well, thank you, Chair. I just wanted to echo on what you just said, basically about the 2 mile radius of the smoke shops being in the, in the neighborhood, as well as the churches and the schools. So that has already gone into effect since the April legislation. Chair to the Director.
Through the chair, that is correct. And so for stores that already have an occupancy permit, they are legacied in. For stores that don't have an occupancy permit, law passed, and by design, they're all scrambling to get their occupancy permit, and some of them are going to be denied by the Board of Zoning Appeals, and some won't, and that's up to the board.
Asking because in the Buckeye Ward 4, currently Ward 4 neighborhood, we have quite a few smoke shops that are within that 2 mile radius. I have a lot of other retail owners that have called my office and also have called Building and Housing, and also did their data sheet of the radius, how close one smoke shop is close to a church, close to a school. So they already sent that information in as well, and they wanted to know when and how those smoke shops can be shut down, because it has Kamala Harris. It is. I'm just saying it's. It has come a nuisance, a very heavy nuisance in the neighborhood of, especially Buckeye Road. We got at least 4 within less than 2 miles, and also close to a church, as well as integration school. So they want to know how fast can that be pursued through Building Housing or through your department. Chair to the director.
Through the chair, so our department, as Catrice outlined, will be very involved with that in coming months, and so that'll be a big help in addition to the work building, housing planning, the Board of Zoning Appeals and the courts are already doing. And then hopefully the state comes through, because once the state says that no Delta 8 can be sold in these non-registered cannabis dispensaries, I mean, they're going to have no choice, hopefully, to shut down. Yeah, so. And they're going to shut themselves down. I mean, they'll go out of business if they're not able to sell that. So
Here's when you guys, you have systems to monitor what's going on, and when we bring you back in later, let's say for the anniversary in April, you could tell us the issues and concerns, and so if we need to amend something, or if we need to change something, because here's how I look at legislation. It moves. It moves. It breathes on its own, and it moves. And so this is new. So some things that we didn't think about that you'll have and you'll document it, and pre-testing and post-testing, really. Pre-testing is where we're at. Post-testing is where we need to be at. You could tell us, and then we could amend the legislation.
Data is going to be very important. Like you said, it's a bit different for something to be on paper and then it be applied to the real world. So we really want to see what's happening in the real world once the legislation is fully implemented, and use that data to make any changes that we need to make.
That helps us out alone, because we have a lot of known unknowns. Let me say this, known unknowns that is interesting to find out. But here's the other piece. If you see any issues and concerns before April, let's not wait until April to say this is where we're at, council members. If you see it in January, March, whatever the case may be, while you're out there, you have to alert us so that we know. That's our job. Any other questions? Yes.
Concern is due to having so many smoke shops in the neighborhood. The harassment is when you have employees that work in the smoke shop, and they have a tendency of standing outside of the smoke shop, smoking, entertaining their supplies to encourage folks to come in to the smoke shop. That is heavy in the Buckeye area. It's constant. You may see 4, 5, or 6 employees or just customers that stand outside on the sidewalk in front of the smoke shop smoking, and they are harassing residents that come down the street. I'm just saying, I know that's social, and that's dealing with public safety, and the 4th District is involved with that. I just say, is that any way? I know this is like maybe a open-end question. Could that be prevented per se? what you guys are doing of dealing with the legislation, or what y'all trying to attempt to do to shut some things down, because I know I get a lot of calls, 4th District get a lot of calls, and a couple of folks also pursue to talk with their attorneys to sue these smoke shops because they have been harassed coming down the street, being encouraged to come into the smoke shop to buy things. So I've been getting quite a few calls on that, as well as 4th District. So could that be part of you guys getting out, walking and talking, viewing these smoke shops, knowing that they are intimidating and harassing residents, to encourage them to come into the smoke shop? Per se, Chair, to the Director, or Councilwoman.
So, two things. I think the tobacco retail license will give us more boots on the ground. So our public health inspectors will be out at least twice visiting these establishments and seeing what's happening. So I think that's helpful. The other part of it is that there is a license fee. That's $500 per retailer. That allows for us to do more retailer education. That allows us to hire additional staff if necessary. And what we want to try to do is make sure that retailers are compliant so that it doesn't escalate. So if we have to use the resources that we gather from the license fee to put more folks on the ground doing that, I think that could be helpful. Anything short of that, I think there are ways to use the no smoking within a certain distance of public buildings to disallow people from smoking outside of establishments. We can definitely look at that. But I think there's definitely opportunity, and with the licensing fee, we'll have additional resources to be able to address it.
That's good. Thanks. Thank you for the information, Chair, to the team, because you have other retail stores that's next to these smoke shops that also call and complain about their customers are uncomfortable even going into their businesses to engage, and that's a deterrent for them to even continue to make a profit or patronizing their businesses. So I get quite a few calls from the other retailers that call me, as well as call them 4th District, because they have now shown that their customers are calling them, complaining about not coming to their business, because not saying that they are afraid, but to go into their business and see a bunch of people standing outside of the smoke shop smoking, their marijuana, thinking that's okay for them, but it's deterrent against another person who want to come into another establishment that now is complaining about the uncomfortableness of them coming out into the neighborhood to be comfortable to go to that other establishment so they can do businesses, knowing the culture that we're dealing with now, per se. So I'm just simply saying that all the different type of calls I'm receiving, as well as 4th District, because we work together, the acting commander and I, the previous acting commander and the current one now, is just the amount of calls that we're getting to say what and how other residents are feeling, or customers are feeling, going into other establishments. So that's now a big concern to customers, period, that having that issue of being harassed per se or not per se. So I just wanted to put that out there. Okay.
You could probably send let's say a letter to the health director. I think we need to look at the same kind of systems as a liquor license, where you can have a cooperative agreement And so that would be a cloud on your tobacco license, but you could set a cooperative agreement. And then if you don't, you do this, you need to do this, you need to do that, and then start documenting them. So when they try to reapply, and that way, I think we have a better way of changing their behavior, because that's what I do in my ward with liquor establishments. Do a cooperative agreement with the law department. And we might have to do that with this right here. That's what I'm thinking.
That's basically has became a big concern with the smoke shops, and I have reached out to the owners who's running the smoke shop, and I have reached out to the landlords who own the building who lease out to the tenant who's running the smoke shop. So we have had a huge conversation in order to diminish this activity, because now since it's a bothersome to residents and customers, we see there's another level that we have to look at too as well. So just to know how to just bring that together. All right, thank you.
Well, you
Thank you.
hold that down. At the law department, look at some of the cooperative agreements, take a look at it, and we could use that as a model. So like what the council lady was narrating to us, we may have to use that. And then that way they could change their behavior and we can get in front of it. I mean, that's what I'm looking at. Councilman?
Yeah, Mr. Chairman, I'm sorry, I forgot to ask. The $500 fee that's collected goes where? Where do we deposit that?
There is a fund that's set up in public health, and it all goes into that fund to fund.
Okay, so the collections will be reflected in the annual budget as revenue for the department itself?
To the charity, yes.
Okay.
Through the charity, yes.
Yeah, thanks.
Is it enough? $500?
So the chair, we were trying to be as fair as we could, but I appreciated Councilman Harsh's suggestion of $10,000. But we were trying to be align ourselves with the other big cities in Ohio that have this program and across the country, and not necessarily be an outlier on that. I remember that, yeah.
Yeah, I don't want to.
You took a look at those numbers, yeah.
Yeah. Council lady, were you finished?
Yes, sir.
All right. I yield to you, Councilwoman.
Good morning, through the chair to the team here. So I'm going to say, let me just start. So at 7:14 this morning, I get a call from a resident regarding another issue regarding dumpsters, and I'm going to go get through that later. But it's prompted me in this part to ask, how many people does the Department of Public Health have to actually enforce this?
Sorry.
Through the chair to the councilwoman. So this is under local code enforcement, and currently we have 6 local code enforcement inspectors. We also have additional staff within community health, myself and my colleague Prince, who will be assisting. So right now there's 8 folks. Once we start getting the license applications in and we have an idea of how many actual retailers we have, there will then be funding to hire additional inspectors if it's needed.
Okay, chair to the team here. Like, this is not going to work. This is, we can't even enforce just the stuff that we currently have. And like I said, I know because I was prompted on an issue that's been going on for 2 years regarding a dumpster, and to think that to get even more work and not having the capacity. So there is just, I have zero confidence that we are going to be able to effectively enforce this in any form, shape, or form. We just are not doing code enforcement, right? And I'm saying from the place of issuing any type of citation violation, then taking it to the any legal ramifications, it is just not happening for the current stuff. So what confidence should Clevelanders have that this is actually even possible? I do not see it. And like I said, this is one issue. And like I said, I am going to take a very different approach regarding this case, because I am going to outline just the level, because it's not just the enforcement, it is the level of it's not my responsibility and not follow through. I am very frustrated this morning. And for as much as people will be in their feelings based on the commentary that I'm going to have, it doesn't compare to the lived experiences of Clevelanders. It is shameful. It is shameful. And I literally just do not know what to do, because I am exhausted going to these doors to get, rightfully so, right? Talking about how horrible we are as a city of Cleveland. And it is in particular as a result of public health and building and housing, and the law department too. It is not cute. Like, what confidence would we have that you all actually will be able to enforce anything to its completion? It's not, this is what is the ideal size of the team that will be able to actually enforce things here for the duration? Because if we can't get a dumpster right, I know for certain we are not going to be able to do no smoke shops.
Through the chair to the councilwoman, I feel your passion. I will just.
It's not a passion. This woman is living next to a dumpster on the street that is in complete violation of our codes. And for 2 years. Like, we cannot get a dumpster right. How are we going to get smoke shops right? With 6 people who don't have the capacity, that are already overworked, what is the plan to actually get real enforcement in the city of Cleveland? You can go there right now, like, this don't make no sense, y'all. This is not even even basic services. We are just failing our people, and we're going to continue to fail them. 6 to 8 people are not enough to just enforce the smoke shops, let alone every other violation in the city of Cleveland, from food and health, things that are going on with like public health and housing, air quality. I got another one on East 81st. Like, what are we doing?
Through the chair.
And it's for, this ain't really you. This is on actually, I mean, no. I'm just saying, but no. This really is not her, because she is, Ms. Minor is a person who is dealing, trying to help plan the plan, but overall for the structure of public health, if you're saying 6 people or 8 people for the entirety of the city of Cleveland, how could we possibly think that this is going to work based on the capacity where we're having limited resources, ever increasing problems? This is just, it is not working. It is not working. And to, it's really not, okay, go for it, go for it.
Through the chair to the councilwoman, and director will chime in, I'm sure. One, I want to correct one statement first that I made. When I say 6 to 8 people, that is just local code enforcement. I know you brought up issues about food licensing and other aspects of public health, air quality. Those are additional inspectors and staff that we have within the department. So when I talk about the 6 to 8 people, I'm talking about those who would go out and do the 2 inspections twice a year for tobacco retailers. And I feel confident in their ability to do it because, one, licensing is different than addressing, say, high weeds and grass and other complaints that folks might have. You have a license, there's a checklist of things that you have to have, and either you have them or you don't. There's an underage buy, you either don't sell to a youth or you do sell to a youth, and there's a remedy and a course of action that goes along with that. I get that it's time-consuming and will take some time away from our staff, and that we do have lots of challenges in the city, but I do think that it was the right thing to do to have a tobacco retail license, one, so that we can get into the stores, and I think it's the right thing to do to be able to use the resources that we have from there if we are short on resources to be able to do the licensing, do the program, and enforce the program.
I think that, can I say this real quick? She was just comparing and contrasting, and she was talking about the way. All right, we push this, but when other people come to the table and they say they're going to put together a project or a program, all things fall apart. So you putting together your program, and she's saying that they don't execute. And if they can't get a dumpster right, a dumpster, and I mean a dumpster, how do you feel that they're going to get what you're doing right? Because she's talking about the way, and people just don't execute.
And just to follow up, to be clear, from the chair to the public health team, there's no question about if it's the right thing to do. What I am questioning is the actual ability to actually get it done. So in addition to smoke shops, what are all the other things these inspectors are responsible for?
So this is under the local code enforcement, through the chair to the councilwoman. This is under local code enforcement. So this team of 6, they handle licensing of barbershops, laundromats, and hotels. They'll handle licensing of tobacco retail licensed facilities. And they also answer nuisance complaints.
Just follow up through the chair to the team. What are nuisance complaints? Tell me what are the nuisance
Through
complaints?
the chair to the councilwoman. So that could be high grass, that could be rats and rodents. Mold, I believe, is on the list. Generally, folks will come to the public health department, and it may or may not be an issue that our team addresses, but we then connect them to the right department if it is not.
And just follow up through the chair to the team. Can you have just in general, prior to this, on average, how many licensing for all these people, the different licensing that we have to check to, and the nuisance complaints, how many do we do those in a year prior to the smoke shops? Just.
Do you have a-
Through the chair, we received 6,000 complaints last year. About,
Yep. I think she asked about licensing.
oh, okay, I thought you meant nuisance.
6,000 complaints. And then
Spit
for the
for all.
licensing, for the licensing, how many, through the chair to the thing, how many other licensing that this team is responsible for? At least I'm assuming because someone had license, I don't know, the annual check-ins or, the check-ins. How many licensing is this currently team responsible for?
Through the chair, 6,000 is inclusive of all that. I don't remember what it is broken down, but it's a pretty small part.
Okay.
Through the chair, most of what we get, we're optimistic about 311 integrating in public health to help. They have started that integration, but a lot of what you're describing is a real problem. Traditionally, building and housing inspectors have gone out with public health inspectors. It doesn't really help the enforcement of law for both teams to go out there, but it does to make sure that it's documented. And so we are working with building housing with the 301 team to continue to get better in the court system. But I will just say, I've worked in hospitals, intensive care units, emergency rooms. I have never worked with a harder group of people than I have at the Cleveland Department of Public Health. And they're watching, and they hear what you're saying. And I just have never worked with a harder group of people. So I respectfully, disagree that we're not doing anything and that we're incapable.
I didn't say, for clarification, to the chair, to the director, It's not a question of them doing it. I said, I do not believe that you all have the capacity to actively meet the requests that are required from the city of Cleveland. That's what I said. So again, if you're saying you got 6,000 complaints now, you're going to add potentially 500 to 800 additional licensing and inspection on there. I am saying I do not think you all have the capacity to do it well and to be able to effectively do it to the team and at the speed that people done. It's not a question of people doing their job. It's of actually being able to set people up for success and to a standard of excellence that people in the city of Cleveland are not getting. That's what I'm saying. I'm talking, exactly. We do, that's what capacity means. You do not, that team does not have the necessary resources to be set up for success so that people can have excellence, so that an issue like a dumpster doesn't take 2.5 years to address. That's what I'm saying.
So let me ask you this question.
And yes, I am irritated, and like I said, I hope people are, you can be irritated through the chair to the director. You can be irritated on my tone and what I'm saying, but you are not, we are the people not living next to the dumpster. Like, that's the thing, it's like, it's so frustrating. It's like people get in their feelings because the way you talk to them, but it's like, after this morning, I'm just looking things, I'm going through pictures, I'm going by this woman's house. It's like, what's the other option? Like, because if I literally knew a different option to be amenable with people and be nice, because that's what people want, they just want you to be nice and like, let's just work together. What do you do after 2.5 years? I don't know any other way. Like, I feel like this is how you have to force my hand to, yes, do shame and pointing out all the deficiencies, because people just like will be in their feelings. And then it's like, oh, well, I'm just going to ignore her request because, oh, she come in and she hurt my feelings. But at the end of the day, it's not about me. It's about Miss Messinger, who living next to a dumpster.
That's the issue.
That's the issue. And nobody seems to actually take those types of things in consideration. And to tell me that we get 6,000 nuisance complaints a year and we're about to add another workload of 500 to 800 potentially or so, and they're supposed to do it on a semi-annual basis, if I'm hearing that correctly, and to think that, but you add that load to potentially 1,000 to 1,600 additional workload, and think that this group of 6 to 8 people will be able to handle it with no real plan to increase the team members on this team is illogical. There's nothing that has been proven that what is being presented is going to be successful. Nothing.
We presented a plan with
I
the
saw
red
it.
slides.
Let
And
me
we
ask you
also have said that we are going to add staff with the funds that come in from the tobacco retailer. So
When you
there's a
say
plan.
staff, like, how many
Personnel.
staff?
In addition, with those 6,000 complaints, many of them were duplicative. Many of them were for
double.
issues that the public health isn't able to address. Some of them are meant for animal control, and they come in through us.
But-
of them are meant through building and
but you
housing.
know what,
and they
the
come to us. So
councilwoman-
we are working hard on improving the systems.
She do have a point with the workload. So what you did, right now you cross-training workers so that you mentioned 6 workers, but they're doing, and they have a workload, but they're doing other tasks as well. Is that correct? Let me finish. I want to break this down. I want to figure something out. Because when we meet for operational planning and we look at labor, and you tell me a worker is doing one task, you got to tell me how many tasks they're doing that one worker. Okay, because their workload might be going into tobacco shops, but you just mentioned you cross-train them. That's called cross-training to do other tasks. So how can they get to that?
Right, so our local code enforcement staff, they're responsible for hotels, barbershops, and laundromats. And then they'll also go into tobacco retail shops. And it's that group that handles those in addition to nuisance complaints. There is the possibility other cities have used their food inspectors to also do tobacco retail license inspections, at least the technical ones, because they are going into a lot of those establishments already. So that's something that we could consider. We're trying to get it off the ground to see where we need to go next. There is plans to do hiring of additional staff as needed, and once the funds are collected, that gives us the resource to be able to do that.
I'm gonna say one more thing, Councilman.
Yeah.
Okay, so what you have to do when you look at your labor, because you cross-training them, is to, on all your, you gotta look at that. And you don't know, you give someone a workload, is it too much? Is it too much? So you gotta be able to, before you come back to us, to let us know. Because especially when you, Director, I'm not pointing at you, when you come to budget hearings, then that way we know. Because she has a valid point there. I didn't know, I'm thinking here that you have 6 workers, the focus is on the smoke shops, but I didn't know they're doing other tasks as well. And with those other tasks, it's going to be hard to, and then some workers, they might not, it just might not be for them to do that, to execute, to do that, that kind of work, or they might not want to do it.
I just want to echo Director's point, like, well, kind of echo his point. It is not the easiest job to get people to work in public health. It's a thankless job lots of times. So we do want to take care of our staff. So if it becomes overwhelming, or if it's a challenge for the staff that are dedicated to this work to do it, we are going to do whatever is necessary or within our means to be able to support them. The last thing that I want to do, or the last thing that I know our colleagues want to do, is just to be left out there to handle things on their own and feel as if they're not supported. And part of what we're trying to do is put everything in place so that they feel supported and that they do have the support that they need. It's difficult to address all of the issues that individuals are going to bring to the table. The nuisance complaints that we get are largely unknown, and our staff, I think, go above and beyond trying to get resolutions for some of these issues, even when they aren't issues that public health would normally have to address.
You got to break that down, because you're over them and with the labor. She bring up, I'll yield to you in a minute. When we come back, you take a person, their workload, as the councilwoman just narrated to you, you cross-training them, can they get done? Because then smoke shop people won't take us serious. They say they're not going to come here anyway. They're not going to answer Councilwoman Deborah Gray complaint. I won't see them. I mean, I'm serious with that. So you gotta be able, before you put people out, to try to figure it out, the workload, and you cross-training them, or are you giving them too much? And I yield back to you, Councilwoman.
So this is the thing, right? So through the chair to the team here. So there was a violation a complaint that went in on December 30th. On January 14th, Public Health is saying there was no violation. Then again, there was another one that was on March 24th. On March 27th, Public Health said there's no violation, meaning, and then they say it's not our responsibility. We only deal with if garbage is outside of the dumpster. Even though every time I go past, I see garbage outside of the dumpster. And maybe I don't know what is happening. I don't know what's occurring, right? And then in August, it said we only look for garbage, even though the placement of the garbage is the dumpster is an issue. And I'm like, well, in this process, did anybody like coordinate with building and housing? They like, well, that's building and housing responsibility. And like, that's part of the frustration, is just like, well, if you know that it's the responsibility of building and housing, you wouldn't get the complaints if we can just get to the source of the problem of moving a dumpster from the street, which is a clear violation. And it says something in there about at some point, let's try to get a court summons or something. I know at this point on October 6th, no court summons has happened. But, again, like I said, waking up, thinking you're gonna have a great week to wake up something at 7:14 in the morning to get talked about how much I'm not doing when I know I'm doing all I can,
You're
because
gonna
I
bring it
have
up.
no,
We get beat
I
up.
have no control over
I know you guys, Director.
who issues tickets, who helps to try to do the problem solving. And like I said, if we can't get this fixed in 2.5 years, I am not confident that the team, it needs to be some additional
Council Lady,
people
let me ask you,
there.
is that issue still there?
Yes, it is. It is.
The director?
Like I said, it's not their responsibility. They're only to deal with the garbage, which the garbage has been there. It was there last Thursday.
We need to move on that.
The dumpster legislation is building code, and so they do a warm handoff, and I'm very sorry that this hasn't been addressed yet.
It's the garbage. It's the garbage too, but every time you have inspectors through the chair to the team, y'all say ain't no garbage there. So I don't know. It's like I'm going there, I take pictures.
No, it's okay.
We can handle the
It's okay.
issue.
Yeah.
No, Director, we gotta handle the issue. Councilwoman, Director, you're gonna handle the issue, Director? You give it over to them, that way we can move on it.
Through the chair, we have, and we will, absolutely.
And do you know what address and?
I could look through my emails to see if there's something
Tell
regarding
them-
this,
tell
but
them the
you can
address.
forward,
Bring it over there. Tell
if
them
you
the
forward it
address.
to me, I'm happy to reach out to
They
the
have, I'm gonna,
the resident.
Right.
I'm gonna send it again
Okay.
with the pictures.
With this director, with me, I call all the directors. If I can't sleep, they call me. What time I call you in the morning? Sometime 2 o'clock in the morning. I said, I need to have this done, and that to be done. You see what I'm saying? Wake
Yeah,
up
I'm
and
not
it's
that
done.
type of person though. That even for me, like it's through the chair to the team here. It doesn't do me any good to call you all and a director, right? It's just like, what is the process to get it done? Literally, something is happening if a resident is complaining about the dumpster and the garbage. Every time the inspector comes there, they say it's no trash. But literally, she calls me and I go myself. I've taken pictures. I see the trash even outside of the dumpsters. So there is something that is wrong. Do you understand what I'm saying? It's like, am I crazy? Am I not seeing this trash?
You got it.
Am I
We're gonna
not,
find out who
I
that
don't
director
know.
is. We'll
I just,
find who the director
literally,
is
this is
and
just
see
one
that.
issue. And I'm saying is in the context of we're talking about inspectors that are going to now then be tasked with doing all of these licenses. It remains to be seen, but I am not confident, based on my experience thus far, that the team there is not going to be set up for success. And that's what I believe.
Just bring us the workload because we'll be back here within 2 weeks or a month to discuss the health department. And then we'll bring that in because it's very serious what she mentioned. I'm very, very big on labor and the culture of labor. And I'm real big on execution also. You have to execute to get it done. Director, we'll get to that part right there. You know what, Councilwoman? I call whoever can get it done. I gotta get it done. And I understand what you're saying because, Director, we get blamed for it. If you go in the store to get a loaf of bread, it might take you 2 to 3 hours to get out because everything is, we get blamed for everything. And so that's her frustration. She's not upset with you guys. It's just the frustration. She's trying to get it done, and then the residents jumping on her and make you frustrated. We all feel that, isn't that right, colleagues? Because they don't know you. And Director, the only time they see him is that he walking in the streets with me or he come to my meeting. But us, wherever we go, we get it. So that's the frustration. Are you, Councilmember Slife? Were you finished, Councilwoman? We'll take care of that. And I'll even do feedback and talk with the director. I'll see you tonight as well as call you tomorrow to see that we got it done. All right, so we'll be cool beans on that. Councilmember Slife?
And sensing that we're wrapping up, and this, I want to zoom out. I'm not talking about an individual department, but I'm talking kind of at the organizational level.
But you're talking about health, right?
We'll talk about, yeah, but this is related.
Are you okay with this?
I'm okay, yes, I'm okay with this, but what I want, as we move towards operations, what I think we don't always have a sense of is, during budget hearings every year, people will say to a director or commissioner, is this the budget you need to do the job?
Yeah.
And quite frankly, I think it's an unfair question because you are given a budget by people who work above you, and you have to figure out how to do what you can with that budget. So I think where we are constantly trying to figure out on this continuum of idealistic city services that are unconstrained by budgets and a pragmatic level of city services that are speaking to what our budgetary constraints are. And I think maybe a way that what I hear from Councilman House Jones and my interpretation of it is a feeling that we are having an idealistic level of service, but we're not, but our staffing is more pragmatic. And what we don't know is, you know, at any given policy, are we basing our, for example, a semi-annual inspection or review, is that idealistic or is that pragmatic? And if it's idealistic, then we need to be putting more staff members towards it so we can get there. And if it's pragmatic, we at least need to be honest with people and saying that there are budgetary constraints that prevent us from doing more sooner and faster. And then it's for us to decide if we agree that that is a pragmatic thing we need to deal with, or if we need to find resources elsewhere, however that occurs, to supplement. So I think as we move towards budget hearings or operational hearings, I'm always interested in understanding how we are determining staffing decisions and what and that delta between what is pragmatic and what is idealistic. And I've been told by some that it would be a ineffective use of times to come up with ideal city services. We're gonna plow every street, you know, within 6 hours of the snow ending, and we're going to fill potholes all in 1 week, and everybody gets leaf pickup, and we're able to do inspections on a quarterly basis. That it would be, we would be spending a lot of time coming to a conclusion that we know is not feasible. My worry is not going through that exercise, we never really have a sense of how we can most effectively spend the next dollar. So if it's possible in operations hearings to kind of delve more into that disconnect between what we want and what we can afford, I think it would help us understand where we need to potentially be thinking about the financial implications of adding headcounts. So.
We'll put in the operations that labor and management, as well as the behavior. You know, the hardest thing, you know, I've been in management almost, well, all my life. And I watch a lot of frontline workers. How do you manage them? You can even have your workload here, but if that worker is way out, let's say on Denison or whatever the case may be, or you send them out there, director, to look at the dumpster. How do you manage them? How do you know they're going to do it? How do you know that, I mean, you kind of know it might only take 45 minutes to do a certain task or workload, but they take 2 hours or 3 hours. And I know we have GPS on some of the vehicles. We don't have it. So, I mean, that's the hardest thing when I look at it. How do you manage frontline workers? This out there, because that's what you were saying, fall back on you guys also. So you get the councilwoman, because we get beat up, but then we come and talk with you guys, and then you have to try to manage them, but you don't know how to, and it's a culture thing, it's in the culture as well, for people to execute.
Yeah, that's what I'm saying. I mean, the people are doing their jobs.
Right,
and
right. I'm not saying they're not. I'm not saying they're not.
I agree with the point that the
I'm
system's
just saying the
not working
council
for the
lady
residents. Yep.
was saying for 2 years, or is it 2.5 years? That didn't happen.
I agree. Yeah, our team's texting me now. They're going to look into it, and so as soon as you send me the information, we'll follow up and see what the holdups been.
Because I'm not saying they're not working. I'm not
Thank
saying
you.
that. But you know, when you.
Capacity, through the chair, it's not about people not doing their jobs.
Right.
It is the capacity to handle the volume of complaints that are coming into this system in an effective and efficient manner. That is the problem. Not the 6 people. It just needs to be more than 6 people, in my opinion, and based on the expectation of everyday Clevelanders, whether you are a resident, whether you are a business owner, whether you are a visitor. It's not meeting what I would say like a baseline expectation of delivering on services. it is too much. We really need to look at how do we expand it so that, because this is how you have, I feel like this is violence prevention. This is how you have strong, vibrant neighborhoods, getting this stuff right. When you are on a street where it's just trash everywhere, people's behavior reflect that. That's why people start wilding out. This is what I'm saying. This is where the frustration is. It's like, if we don't get this stuff right, all the other stuff, the other investments that we're making of, public safety, it does not work. And it's not working. That's what I'm saying. That's all, and I don't know, like I said, I am open to suggestions of how, after 2.5 years on something that I think is relatively simple, there are some challenges. And I know people want me to be a little bit more diplomatic and let's just work with it behind the scenes. I have tried. And like I said, waking up to 7:14 a.m. about all the things I am not in is just, no. I'm not going to take that without sharing the heat.
We understand. We can be it too. You know what? Looking at the budget book, I'm thinking about what Councilmember Slife was narrating to us. Some departments, I know they work very hard in health. I'm with you, because I stop by, I see you guys, I talk with them, and you look at staff capacity. Some departments, when they tell us how much staff they need, and then when they come back around to transmittal, they might say they need 20 people, Councilman's Life, and they only hire 7 or 8 people. But you could use that money, okay? So it should be, let's say in the third quarter, that we transfer the money to the health department or to whatever other department. Because why are we sitting on, because labor is dollars. The staff is dollars. Healthcare, unemployment, all that money we set aside to hire and train a worker, and the money is sitting there. And then that department, whatever that department is, they didn't hire the 20 people. They only hired 5 or 8. What they're doing, they're blowing labor dollars. It's just sitting right there where they could transfer the money to you. How's your staffing doing, Director?
Through the chair, we are fully staffed in the division environment for the first time in decades.
Forever.
We think, so, yeah. But I agree. I think what you hear from the director is the budgeted amount is the right amount. It's just filling those spots, and what, building housing can speak to what their struggles have been there, and they're working through that. But we've been able to become a very attractive place to work. We're holding our folks accountable. We don't, unfortunately, have folks that pick up the trash. And so we're working with, limitations of what we're able to do. And, we could always continue to work to make the system better. We agree that it's not working for all our residents. Appreciate it.
You come to my community meetings, and you see they jumping on me left and right about issues. So, any more questions? So, Council Lady, the director said he will be on your issues and concerns, our issues and concerns, because it affects the entire city, and you'll see her tonight. Is that correct? Saying that, and no more questions, the Health and Human Service and the Arts Committee is adjourned.